Almost half of all dementia cases worldwide are preventable. Not 10%, not a quarter, almost half. And the part that should really stop you in your tracks? Most people whose brains are already starting to decline have absolutely no idea it's happening. The 2024 report from the Lancet Commission identified 14 modifiable risk factors behind 45% of all dementia cases globally. 14. That means there are 14 places in your life where the story can go differently. Today we are going to go through all of them, what they are, how they work in your body, and what you can realistically do about each one. If clear, honest health information is what you're here for, hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Dr. Hayes is 1,000 subscribers, and every single person who joins moves us closer. Scan the QR code on screen right now to find the checklist for this video on my Telegram channel. It's posted there for you. Hearing loss is the one nobody sees coming. Most people think of it as an inconvenience, something you adjust to, something you manage. What the research from 2022 and 2023 tells us is different. Untreated hearing loss raises your risk of dementia by 1.5 times or more. That is a 50% increase in risk from one factor alone. Your brain is not a static organ. It runs on input. Neural connections form and stay strong only when signals are traveling through them. When the auditory input narrows, the voices, the music, the ambient sounds of daily life, whole regions of your brain start receiving less and less stimulation. And the brain's rule is simple. What doesn't get used starts to shrink. Basic neuroscience. A second mechanism is at work here too. When hearing becomes difficult, people start pulling back from conversation. It gets tiring, awkward, embarrassing. They go out less, they call less. And social isolation, which we will come back to, is itself an independent risk factor for dementia. One thing pulls the next. This is a well-documented pattern in primary care. A patient stops engaging socially. The family assumes it's just getting older, and years pass before anyone connects it back to untreated hearing. A hearing aid is not a symbol of age. It is a tool that literally protects your brain. If you or someone close to you has noticed worsening hearing, that is worth raising with an agiologist sooner rather than later. The same logic applies to your vision. The eyes account for roughly 80% of all sensory information your brain receives. 80%. When your vision deteriorates, your brain starts starving for input in exactly the same way it does when hearing goes. And here is a specific number worth sitting with. Timely cataract surgery. That is the procedure to remove a clouded lens from the eye, the one that makes everything look like you're seeing through frosted glass. Timely cataract surgery reduces dementia risk by 29%. Time equals, quote, 0.5 seconds, quote, / greater than nearly a third. That is not a small effect. That is the Lancet Commission citing a direct link between restoring visual input to the brain and protecting cognitive function. Two organs most people never connect. Your eyes and your brain are part of one system. Cataracts develop slowly. People adapt to seeing worse and start thinking it is normal. It is not normal. It is a treatable condition. Getting your eyes checked regularly and acting on what you find is worth discussing with your ophthalmologist. Now, sleep. And I want to address a myth directly because I hear it constantly. People say, I sleep badly. I wake up early. I toss around. I can't fall asleep. But that's just what happens when you get older. No. Poor sleep is not a normal feature of aging. It is a problem that can and should be addressed at any age. And it turns out to be one of the most important things happening inside your brain every night. During sleep, especially the deep phases, your brain activates what researchers call the glymphatic system. Think of it as the brain's overnight cleaning crew. This system flushes out metabolic waste products that accumulate in brain tissue during the day. Among those waste products, tau protein and amyloid protein. These are the exact same proteins whose abnormal buildup is the hallmark of Alzheimer's disease. Amyloid plaques and tau tangles. That is what Alzheimer's looks like under a microscope. The glymphatic system's job is to prevent that buildup, and it can only do its job when you are asleep. When sleep is poor or short, that cleanup doesn't happen fully. The toxic proteins stay, and each disrupted night adds a little more to the accumulation. Research conducted on living human subjects, not just animal models, has shown that even a single sleepless night significantly disrupts tau and amyloid metabolism. One night. Now, picture someone who has slept poorly for a decade. Their brain has not been properly cleared for years. When Alzheimer's is diagnosed 20 years down the line, no one traces it back to the sleepless nights in their 50s. But the connection is real. You already know what a bad night does to your thinking. The heavy head, the slow words, the short fuse. That is not just tiredness. That is your brain telling you it did not finish the cleaning cycle. There is also the phone before bed problem. Blue light from screens hits a structure in the brain called the suprachiasmatic nucleus, the body's internal clock, which governs when you feel awake and when you feel sleepy. Blue light tells that clock it is daytime. The brain responds by suppressing melatonin, the hormone that initiates sleep. No melatonin, no clean drop into sleep. On top of that, anxiety-provoking content in news feeds triggers a stress response. Cortisol rises, the sympathetic nervous system activates, and instead of winding down, your brain enters threat analysis mode. This feeds something called rumination, a loop where the mind keeps replaying the same thoughts, the same worries, the same what-ifs. And the loop does not stop just because your eyes are closed. What actually helps? Research supports putting the phone away at least 45 to 60 minutes before bed. Progressive muscle relaxation. Slowly releasing tension from face to feet, one muscle group at a time, has a documented calming effect. Breathing with a long exhale. Inhale for 4 counts. Exhale for 8. A longer exhale activates the parasympathetic nervous system, the system responsible for rest and calm. Start with the face. Unclench your jaw. Release the tension in your cheeks. Let your tongue drop from the roof of your mouth. The body follows. Chronic insomnia with an anxiety component is treatable, and it is worth raising with a doctor or a behavioral health specialist, rather than simply accepting it. Now, muscles. This one surprises people. Starting around age 30 to 35, the body naturally begins losing muscle mass. After 50, that process accelerates somewhere between 1 and 2% of muscle mass per year. By age 80, some people have lost up to half of their peak muscle tissue. Most people connect this to physical strength or appearance. Almost nobody connects it to the brain, but they should. Muscles are an endocrine organ, meaning they produce and release hormones and signaling molecules called myoines. These molecules directly influence brain function, stimulate the growth of new neurons, and regulate inflammation throughout the body. Less muscle means fewer myoines, reduced blood flow to the brain, and a higher baseline level of systemic inflammation. A study published in 2025 confirmed that sarcopenia, the clinical term for age-related muscle loss, is a causal factor in cognitive decline, and that physical activity is the direct mediator of that relationship. Translation: muscles literally protect your brain. Muscle loss literally works against it. A sedentary lifestyle increases dementia risk by 1.5 times. You do not need a gym membership for this. 10 minutes of morning movement every day, or 2 30-minute brisk walks per week, is already enough to meaningfully reduce the risk of cognitive decline, according to the research. The key word is regularity. Occasional intense exercise is far less effective than daily moderate movement. It does not require equipment or a specific location. It just requires consistency. Balance is another early signal that most people misread. A slight unsteadiness when walking gets attributed to blood pressure, to bad vessels, to something vascular. But your balance is controlled in part by the cerebellum and the frontal lobes, the same brain regions involved in planning and coordination. And these areas respond early to the kind of changes that precede cognitive decline. Impaired balance and declining cognitive function often move together. That connection is well established in the neurology literature. Try this. Stand near a wall or a chair for safety. Lift 1 foot off the floor and hold it 10 seconds. Switch sides. If you cannot hold still for 10 seconds on either foot, that is a signal worth noting. The vestibular system and cerebellum respond well to training, and balance exercises are simple, doable at home, and produce measurable improvement within weeks. The harder changes to catch are the ones happening inside. Invisible, chronic, slow, visceral fat. This is not the fat you can pinch under your skin. It is the fat packed around your internal organs, your liver, your intestines, your pancreas. Externally, a person might just look a little heavy or have a rounded abdomen. But this internal fat is metabolically active in a damaging way. It continuously releases pro-inflammatory molecules, creating what researchers call chronic low-grade inflammation, a slow, silent, symptomless burn that produces no fever, causes no pain, and goes completely unnoticed. But over years, it damages blood vessels and nerve cells, including neurons in the brain. Visceral fat also drives insulin resistance, a condition where the body's cells stop responding properly to insulin. Insulin is not just about blood sugar. It plays a direct role in brain function, protecting neurons and regulating signal transmission between brain cells. When insulin resistance develops, the brain is affected too. Some researchers have gone so far as to call Alzheimer's disease type 3 diabetes, and the metabolic connection between impaired glucose handling and cognitive decline is that close. The Lancet Commission's 2024 report added high LDL cholesterol, the bad cholesterol, to the official list of dementia risk factors for the first time. Monitor your waistline. Get your cholesterol checked. This is not about aesthetics. It is about what your brain looks like in 20 years. Now, the early warning signs. The things to watch for in yourself and in people you care about. Speech is one of the earliest and most reliable markers of cognitive change. When neurodegeneration begins, language starts to simplify before the person even notices it themselves. Words that used to come automatically now require a pause. Sentences get shorter. Complex phrasing disappears. There is a documented clinical pattern where a person's vocabulary narrows gradually over months, and the people around them just adapt to it without registering it as a change. If you or someone you love is taking longer to find words, trailing off mid-sentence, or speaking in noticeably simpler terms than a year ago, that is worth a conversation with a neurologist. Memory lapses are next, but it matters which kind. Walking into a room and forgetting why you came in, that happens to everyone. But frequently forgetting what you said 5 minutes ago, regularly losing names of people you know well, confusing the sequence of recent events, these are different. Clinically, These early-stage changes are called mild cognitive impairment or subjective cognitive decline. Neither one is dementia, but both are the window during which intervention is most effective. Spatial navigation is another one. GPS has replaced one of the brain's most demanding tasks, the hippocampus. The structure in the brain that is first and most severely affected by Alzheimer's is deeply involved in spatial memory and navigation. When you always outsource navigation to your phone, the hippocampus stops getting that workout. Try driving somewhere familiar without GPS. Navigate by memory. This is not nostalgia. It is deliberate training for a brain region you want to keep sharp. If you want an objective measure of where your cognitive function stands right now, the SAGE test, the self-administered gerocognitive examination, is a standardized self-assessment tool available online that you can complete at home and interpret yourself. It can help you determine whether a neurology appointment makes sense right now, or whether things are within normal range. It is a starting point, not a replacement for a specialist who can detect subtle changes the test will not catch. So, what can you actually do to protect your brain? Not passively hope for, but do. Move every day, even 10 minutes. Physical activity stimulates neurogenesis, the growth of new brain cells. It strengthens blood flow to the brain. The myoines released by working muscles directly support neural health. Brains in sedentary bodies shrink faster. That is not a scare tactic. It is documented in neuroimaging research. Protect your social connections. The Harvard Study of Adult Development, one of the longest-running studies in medical history, spanning nearly 80 years, found that the quality of social relationships is among the strongest predictors of brain health and lifespan. Not the number of contacts in your phone, the depth, warmth, and regularity of real human connection. People with rich social lives preserve cognitive function significantly longer. Argue about ideas. Go to plays and galleries. Have real conversations. These are all forms of brain exercise. Keep learning. Low educational attainment increases dementia risk by 1.6 times. But this is not about degrees. It is about whether you continue learning throughout your life. The brain has neuroplasticity, the ability to form new connections in response to new experiences. Learning a second language, picking up a musical instrument, reading demanding literature. One study showed that reading serious fiction for 2 months produced measurable structural changes in the brain in the direction of health. Not passive scrolling, not content that skims the surface. Literature that demands attention, empathy, and analysis. Read aloud. It activates multiple brain regions simultaneously. Write by hand. Fine motor activity like writing, drawing, or knitting stimulates large areas of the motor cortex. This is not a hobby. It is neuroprotection. Address your emotional health. Depression is not a character trait or a phase. It is a medical condition, and it increases dementia risk by 2.2 times. The mechanism is well understood. Depression raises inflammatory markers in the blood and brain, disrupts neurogenesis, and measurably reduces the volume of the hippocampus. Depression and cognitive decline reinforce each other. Leaving depression untreated damages both your emotional life and your cognitive future simultaneously. Persistent low mood, loss of interest in things you used to enjoy, chronic fatigue, disrupted sleep, these are worth discussing with a healthcare provider. Depression is treatable. Early treatment protects the brain. Stop smoking. Quit drinking. Smoking raises dementia risk by 1.2 times, alcohol by 1.3. And I want to spend a moment on alcohol specifically, because one of the most persistent myths in health culture is still circulating. A glass of red wine before bed is good for your heart. A little cognac is practically medicinal. This is not medicine. It is a story the alcohol industry worked very hard to place in the public mind. The current position of evidence-based medicine is unambiguous. There is no safe dose of alcohol. Every amount causes harm. The only question is how much and how fast. For the brain in particular, regular consumption, even moderate, accelerates tissue atrophy and disrupts the sleep architecture that the glymphatic system depends on. The glass before bed for relaxation is, in reality, a double strike against the brain. There is a well-documented case from clinical neurology that illustrates how these factors interact. A man in his late 50s, referred to as James in the records, presented with mild word-finding difficulties and occasional disorientation when driving familiar routes. He slept poorly, had a sedentary desk job, drank 2 glasses of wine nightly, and had untreated mild hearing loss. Each factor alone was manageable. Together, they had been quietly compounding for years. His neurologist noted that addressing even 3 of these concurrently produced measurable cognitive stabilization within 18 months. Not reversal, stabilization. But that is the point. Early intervention changes the trajectory. Timing matters more than most people realize. All of these risk factors carry different weight at different ages. After 40, the rate of age-related brain changes begins to accelerate. After 50, dementia risk roughly doubles every 5 years. The earlier you start working on these factors, the stronger the protective effect. Which brings me to a question that genuinely shapes the answer I'd give you. How old are you? Write it in the comments. Age is not just a number here. It determines which risk factors are most pressing for you right now. And it helps me create content that speaks to exactly where you are. So, here's the summary of what we covered. 45% of dementia cases are preventable, and the evidence behind that number is solid. Get your hearing and your vision checked and act on what you find. Do not wait. Fix your sleep. The phone goes out of the bedroom, the schedule stays consistent, and chronic insomnia is worth treating. Move every day. 10 minutes is a real minimum, and it matters. Manage your weight and waistline and have your cholesterol checked. Stay socially engaged. Keep learning. Read real books. Take your emotional health seriously. Depression is not a personality trait. It is a treatable condition that directly affects your brain. Stop smoking. Remove alcohol. And if you have noticed changes in your speech, your memory, or your spatial orientation, run the SAGE test and book time with a neurologist. Early is always better than late. If this gave you something useful today, subscribe and leave a like. It directly helps this channel reach 1,000 subscribers. Share this with someone in your life who would benefit from knowing any of this. And scan the QR code on screen to join my Telegram channel, where I post practical health checklists and follow-up content between videos. Everything here is for educational purposes only. Your health picture is yours alone.